Hello everyone, I hope you all are doing good and studying well. Today I am going to discuss with structures of teeth. Teeth are composed of enamel, the pulp, dentin complex and cementum. Enamel Enamel formation is called amelogenesis, which is formed by the cell ameloblast. These cells originate from the embryonic germ layer known as ectoderm. Enamel is the hardest substance of the human body. Enamel is a highly mineralized crystalline structure. Hydroxyapatite in the form of crystalline lattice is the largest mineral constituent. It is made up of organic matrix protein and water. This is the chemical composition. It is composed of millions of enamel rods or prism, which are the largest structural component. Structural components of the enamel prism are millions of small elongated apatite crystallites that varies in size and shape. The crystallites are tightly packed in a distinct pattern of orientation that gives strength and structural identity to the enamel prism. The crystallites are irregular in shape with average length of 160 nanometer and average width of 20 to 40 nanometer. What is the effect of fluoride on enamel? Enamel is soluble when exposed to acidic conditions, but the dissolution is not uniform. Solubility of enamel increases from the enamel surface to the dentino-enamel junction. When fluorides ion are present during enamel formation or are topically applied to the enamel surface, the solubility of surface enamel is decreased. Fluoride can affect the chemical and physical properties of apatite mineral and influence the hardness, chemical activity, and stability of enamel while preserving the apatite structure. What is pulp dentin complex? Dentin and pulp tissues are specialized connective tissue of mesodermal region formed from dentinal papilla of the tooth bud. Pulp is divided into the following: coronal pulp and radicular pulp. Coronal pulp is pulp chamber located in the pulp chamber in the crown portion of the tooth, including pulp horns that are directed towards the incisal edge, incisor ridges, and cusp. Typical pulp is located in the pulp canal in the root portion of the tooth. Pulp contains nerves, arterioles, venules, capillaries, lymph nodes, connective tissue cells. Function of pulp: formative of developmental function, that is the production of primary and secondary dentin by odontoblast. Nutritive function: it provides nutrients and moisture to dentin through blood vascular supply. Sportive function: sensory or protective function, provides nerve fibers within the pulp to mediate sensation of pain. The defensive function of the pulp is related primarily to its response to irritation by mechanical, thermal, chemical, or bacterial stimuli. Knowledge of the contour and size of the pulp cavity is essential during tooth preparation. Pulp cavity size varies with tooth size among individual and even within a single person. Within advancing age, the pulp cavity usually decreases in size. What is dentin? Dentin forms the largest portion of the tooth structure, extending almost the full length of the tooth. Externally, dentin is covered by enamel on the anatomic crown and cementum on the anatomic root. Internally, dentin forms the wall of the pulp cavity. Dentinogenesis is process of dentin formation by odontoblasts. Odontoblasts are considered as a part of pulp and dentin tissue Of these odontoblastic cells process. Dentin is called living tissue. Composition of dentin: 70% of inorganic material, that is hydroxyapatite crystallites, are arranged in the less systemic manner. 20% of organic material, approximately 90% type 1 collagen and 10% non-collagenous protein, 10% water. Dentin versus enamel. Dentin is normally yellow in color and slightly darker than enamel. In older patients, dentin is darker. It can become brown or black when it has been exposed to oral fluids. Dentin surfaces are more opaque and dull. Dentin is softer than enamel, provides greater yield to the pressure of a sharp explorer time, which tends to catch and hold in dentin. Enamel would yield a scratchy sound on probing with the sharp explorer. What is hydrodynamic theory of dentinal sensitivity? This is the most accepted theory of pain transmission is hydrodynamic theory, which accounts for pain transmission through rapid movements of fluid within the dentinal tubules. Dentinal tubules are filled with dentinal fluid. When enamel or cementum is removed during tooth preparation, the external seal of dentin is lost, allowing tubular fluid to move towards the cut surface. Pulpal fluid has a slight positive pressure that forces fluid outward towards any branch in the external seal. That means stimuli that induce fluid movements in dentinal tubules distort odontoblast and afferent nerves, leading to the sensation of pain. Many operative procedures, such as cutting or air drying, induce such fluid movements. Cementum is a thin layer of hard dentinal tissue covering the anatomic roots of the tooth and is formed by the cells known as cementoblast, which develop from and differentiate mesenchymal cell in the connective tissue of the dentinal follicle. Cementum is a light yellow or slightly light in color than dentin. Its chemical composition is about 45 to 50% inorganic material, about 50 to 55% organic matter, and water. The organic portion is composed primarily of collagen and protein polysaccharides. Types of cementum: acellular cementum and cellular cementum. The acellular type of cementum it does not incorporate cell into its structure and usually predominates on the coronal half of the root. Cellular cementum, whereas incorporate cells into its structure and occur more frequently on the apical half of the root. Cementum thickness can increase on the root end to compensate for adhesional wear of the occlusal or incisal surface. Cementum join enamels to form the CEJ, which refer to as cervical line. Physiological